Hello, welcome to new tutorial presented by the SchrDbb. In this tutorial, we're going to visualize renal failure. Now, in renal failure, we have two major ones. We have acute renal failure and we have chronic renal failure. So those are the two main ones. Now, we are going to explain each of them simultaneously. In this tutorial, we are going to work according to the SchrDbb algorithm, which is the disease, the differential diagnosis, the endemic disease. We're going to see the cause, we're going to see the complication, we're going to see the background, we're going to see the prognosis. Now, this diagram is going to correspond to a diagram that we're going to explain, which is the mechanism of the renal failure, which is the pathogenesis of the renal failure. We're going to have the next one, which is the pathophysiology of renal failure. Then we're going to have the risk factors of renal failure, and then lastly we're going to see the follow-up inside renal failure. Now, in this transition, we're going to first start by visualizing it in renal failure. So this is our plan. We're going to first start by visualizing this. After seeing the risk factor, the pathogenesis, the mechanism, the pathophysiology, and the follow-up, we're going to clinically correlate this to how can you evaluate for the risk factors on your history, how can you evaluate the pathogenesis from your history and physical examination, how can you evaluate for the mechanism from your history and physical examination, how can you evaluate for the pathophysiology from your history. That is all the elements from the mechanisms to the complication from your history and physical examination, and lastly the follow-up is going to be visualized in the management. Okay, so this is actually the plan of how we're going to work in renal failure. Basically, so after having this plan in mind, we now continue by having the introduction. We now continue by having the definitions of renal failure. Basically,